Hello again, and welcome to Myth Magic Medicine with me, Denise Billen-Mejia. And today, my guest is Case Troutman, who is a family medicine doctor and comes from the Philippines. She's going to tell us all about herself and her journey here. Hi, Case. Thank you so much for joining us.
Oh, hi, Denise. Thanks for having me over. So I am Case Troutman. I'm currently a family medicine physician practicing obesity medicine full-time. I came from Manila, Philippines. It's a country in Southeast Asia. It's, I think, 7,100 islands is how we are taglined. Typically, lots of beaches and stuff. And I came here to the United States for my residency. 15, 18 years, 19 years. I've stopped counting.
Yeah, I
don't
understand.
remember.
How long is medical school in the Philippines?
So we have a 4-year college degree and a 3-year medical school and a 1-year internship. And
So
then
pretty much follows the American system, which is okay. So you got through 8 years of
Yes.
schooling there. Did you practice at all in the Philippines before you came to the US?
I did for like maybe 6 to 12 months. I gotta say, when I graduated my internship / medical school in its entirety, I pretty much had my thoughts set in coming over to the United States. So I did some stints here and there while I was doing my step one.
To get through all the hoops you have to jump through. Yeah. Yes. So where did you come to do the CS portion when you still had to physically fly into the US to take that?
I did it in Michigan, if I remember correctly. I have an uncle who lives in Michigan. I'm an aunt and uncle that lives in Michigan. And no, wait, I think I did it in Chicago. It's Chicago.
Yeah.
I remember I stayed in Michigan because that's where my uncle lived. And
Right.
then I went to Chicago and did it there.
And they've currently, I don't believe it's active. I think they stopped it during the pandemic, and there's no news that they are bringing it back, as far as I know.
I remember very nerve-wracking, like doing my CS the first. I mean, obviously, I've been with patients in the Philippines, but doing it and we actually speak English as a mode of the language of instruction in our school, but doing it as in a different country and someone I don't know, that was very challenging. I remember that.
Yeah. And it's an exam situation. It's quite different when you're
right.
when you're the doctor in the room, as far as for the examinee in the room, quite different.
Yes.
So what struck you? Okay, so you came over, you took your exams, you went back and waited for the results, I assume. And how long was it before you found a residency spot?
What's interesting is I actually applied for the match, right? And I actually did not match. I actually did, and I'm trying to remember the name after the match. What is that? When you have unfilled
Scramble.
Yes, I did the scramble. Yeah, I did the scramble, and right at that time I was staying with my friend in LA, and she got matched to a program in Hershey or Pennsylvania, and so. I gotta say, I remember it was just crushing that you didn't get matched. And I remember like, oh my gosh, what am I gonna do? So and my friend, her name's Margaret, in that program, I think they had like 2 slots that were open. So I participated in the scramble. I sent my CV along with other places. And I got a phone interview after I sent my CV to that program where my friend is, and that's actually where I got accepted.
Good.
Yeah, so very fortuitous for sure.
Yeah, so it was also meant that you had a friend alongside you when you went through the agony of internship.
Yes.
Again, had Margaret trained in the Philippines also?
Yes. Yep. We actually were very good friends. We actually did different medical schools, but we were friends in college. Really good friends in college. We went our separate ways, and then we were both in that phase of trying to apply through residence. So that's why we kind of stayed together, for that time while we were waiting for our match and stuff. Because I remember like, oh, do we have a phone line? Do you have a fax machine? I think that was fax machine back then or something. Like you had to have it handy so that if you need to like send your documents over. So yeah.
Yeah. So good.
And that's how I ended up in Pennsylvania.
So it was a 3-year residency?
Yes, family medicine.
Did you practice family medicine when you came out, or for a
Yeah, I
while?
did. Yep. So I came on with my residency as a J1 visa,
Mm-hmm.
which is very common in international medical grads. So after my J1, after my residency, I did my J1 visa waiver, and I actually did that in Rhode Island.
Okay.
I
And
worked at
when
uh,
when did you develop an interest in obesity?
So yeah, that's a long story, and I love that story actually. So I did family medicine so I did 3 years in Rhode Island. Came here because my husband's family is from Pennsylvania.
Oh, okay.
We met while I was doing residency in
Right.
Pennsylvania.
Right.
So three, and then oh my God, I gotta remember. 3 there, 4, so 7, 10. So 10 years as a family medicine physician, treating
Mm-hmm.
chronic diseases, right? And then it was like 5 years ago, 2018, and it actually really started with my own personal journey, like
Mm-hmm.
um, wanting to lose weight myself and looking into all these like data and what's the best way to lose weight. Had my own journey, and from there really dove into the science of obesity medicine, which is and still is a relatively new field,
Mm-hmm.
or I should say being recognized as a field, because for the longest time we've thought of obesity as just all about willpower, but we
Right.
now know it's a disease, much like any
Mm-hmm.
other.
So, can I ask you though, did you find, had you put on weight during internship or through medical school? Was it stress related for you?
All of the above. So it was funny. I remember being chubby as a child. I lost weight before high school, gained weight during college, lost weight during, and then gained weight during medical school. Again, nights and
Mm-hmm.
shifts, and then lost weight after medical school, and then gain. I mean, it was like an up and
Up and
down.
down, like many of us, yeah.
Yes, yeah, yeah.
So
So
now you concentrate solely on obesity medicine.
yes, 100% full-time obesity medicine, and I love it. I
Do
really love
you
it.
do you work in a clinic or you have your own practice?
I work in a clinic. I work for a health center.
Okay. All right. Okay. That sounds like pretty standard medicine.
Yeah,
I mean, it's a very similar story to many people, including the Americans here. So, what I would really like to explore with you is the differences you found in general life from the Philippines to the US, but specifically around the issue of healthcare and how people feel about health. What
sure.
do you
Yeah.
think? What do you think is the biggest difference for you?
Well, the biggest difference I would say is in the Philippines, we don't really have insurances, or health insurance, I should say.
Hmm.
So when you're sick and you don't have money, that's it. There's
Uh-huh.
no insurance. So I guess everything is cash pay, so to
Hmm.
speak. Preventative care is not as common. I mean, we do have it, but it's kind of still cash pay. It's not like
Hmm.
part of part of you pay a monthly bill insurance and you get a free
Right.
visit or
So it's
so.
harder for people to prioritize that because it means taking the money out of something else.
Yeah,
We're
yeah.
talking about, the
Right.
general. Obviously, there are wealthy people in the Philippines
Of
too, but
course.
the bulk of the population.
And so I did medical school, 3-year medical school, and my internship, I actually did it in the premier hospital in the Philippines called the Philippine General Hospital, and
Hmm.
that is where really people that have no finances have nothing. That's where everybody goes.
Hmm.
So it's interesting in there. That is where I saw patients that have like the biggest tumors, patients that have the most unfortunately advanced cancer, because they didn't have any money to get treatment wherever they were, and they would come to where we train because it's free and you get all the best minds,
Hmm.
of the country. um so I grew up in middle class kind of
Hmm.
category, so I would say growing up, I had, my well child shots. I had my dental appointment, but there wasn't a lot of I don't know, like teaching about, screenings and stuff like that. That I recall.
They weren't teaching obesity medicine then.
Oh, for sure not. No. For sure, no. Yeah. So
what was the biggest thing that struck you when you first came here?
Medical or non-medical?
Oh, well, either, by all means. I mean, if you first got off the plane, the very first time you visited the US, well, apart from the fact it's large and loud.
Yeah, and I'm trying to think. I think I was just the roads were big. That's what I remembered. The highways.
Mm-hmm.
I was very like overwhelmed by that. I mean, and actually I grew up in the city, so I'm used to tall buildings and concrete jungles, but not the wide.
I first came to the US when I was 19, which is why I can't interview myself, because I actually had experienced America for quite some time before I went to medical school. But I came here at 19, and driving back with the family I was with from the airport, I was just stunned by there were like 8 lanes of traffic. It was just mind-boggling. But yeah. So what else struck you when you first came?
I mean,
the food's different, sure.
Yeah, food. I remember seeing lots of cows. So I came to Pennsylvania, right? Which is Pennsylvania. I should qualify that.
Right. You're just I had to look up Lebanon when I was because I used to live in Latrobe, which is outside Pittsburgh. So I sort of know as I'm crossing the state, but I'm not specific. So you're not far from the Amish area, Lancaster area. That
Yep. And Lebanon is definitely surrounded by a lot of kind of
which will be a whole nother discussion of medical care, because they don't do insurance either. I mean they do, but they self-insure.
Right. Yeah.
So from the way your patients view their health, if you can remember back 20 years to when you were practicing in the Philippines, and some things will have changed. What do you think is the biggest difference between the attitude to healthcare between the two countries?
I mean, I guess the one thing that struck me, or as I remember it from before, is honestly the differential treatment we would get as doctors back home.
Mm-hmm.
Like, and maybe this is not answering your question about the care, but I just remembered, like, in the Philippines, what you say as a physician, people trust you and believe it. And I'm sure that's the same way it is here. But I think nowadays I find that patients, tend to look at Google and then look at what you said. And
they look it up to see if you're going to be right. Yeah.
Right.
But now, of course, that 20 years ago here, we didn't get quite as much. And 40 years ago, we had even less. So you might find things are different when you go back to the Philippines.
Maybe I haven't been home, so I don't know. That's true. That's true.
Yeah. Do you think there's as much reliance on lab tests and radiology studies?
Not as much, because again, everything is cash pay back home. So a CAT scan is going to cost somebody like a lot more money than it would probably be here. So I remember as a med student, really just seeing, and maybe just my exposure is mostly just x-rays. I remember some CAT scans, but I would say the more high-tech, higher level imaging tests, I definitely just saw it here in the US. I've heard about MRI and stuff like that when I was in med school, but not as much. And again, maybe that's how it is back home now, and it just wasn't as
right. Yeah, I think there is more tendency to
rely on.
But I think that things are advertised more to the public here than probably anywhere else in the world. So you do get more patients, I think, coming in with an idea of what they expect to happen anyway. No matter what the issue is, they want it fixed.
Right.
I think there's less.
And I think
less responsibility for their own behaviors changing what's happening, but that may be changing in the world.
And I think it's also the demographic, right? So like I said, when I was working as in medical school, because of my training, I'm the exposure I had was really more to the underserved. For, I
Yeah.
didn't really see patients that were in the higher demographic, kind
Yeah.
of where they probably would be, have similar kind of point of view to what
Yeah.
we see here, maybe. So again, back then it was just like, I remember, and again, this is probably off topic. I remember working in we call them wards back then, and when you're in like med school,
Mm-hmm.
working, long shift, and we did the scout work all the time back, as with any place, right? I remember this dad, I was taking care of their child among many children in the pediatric ward. This dad gave me like uh, a a small container of spaghetti, and I was so appreciative of it. Again, even though they don't have much, they would just
Right.
literally give you what they have. They probably saw this poor intern, this poor medical student
Yep.
working so long and not haven't eaten. So oh my God, that was like how many years ago? I still have that memory in my
Mm.
brain.
Yeah.
Yeah.
You do find that in some pockets of in the US, you'll find people bringing, and I have friends who practiced, 20, 30 years ago in rural America, and people would still try and pay them in chickens.
Yeah.
So if you were, let's suppose we have well, let's suppose you were transported back to the Philippines. Do you think that you would be able to practice obesity medicine there? Maybe possibly with a different demographic?
I mean, obesity is not just in the US, so it's
Yeah,
worldwide, right? So it's a epidemic of utmost, crazy proportions everywhere.
certainly. But do you think it's recognized as a separate,
I
not
don't
separate,
think
as
it
a specialty? No.
I don't think it is yet, as it is. I don't think obesity is recognized as a disease just yet in the Philippines. Um, I think it's still, and again, I haven't been home in a while, but
But surely it's also a multifactorial disease. So many diseases are. What do you, as an obesity medicine specialist, bring to the table, do you think?
I mean, I think the best, I would say the best thing I can bring to the table to my patients is hope.
Okay.
Hope that, they're not alone. Number one. Number two, it is treatable. It is
Mm-hmm.
treatable. And I would say what I can give them is just really a path. I think we have the 4 pillars of obesity medicine, specifically nutrition, physical activity, behavior modification, and medication. And just thinking about just nutrition, it doesn't have to be one path. There's so many
Sure.
different ways of approaching nutrition, although we do have that underlying, I'd say, the in important delineation, which is it has to be low calorie, but it doesn't have to be a certain specific diet and stuff.
Mm-hmm.
And I would say the best thing about seeing an obesity medicine specialist is you can get that done in one visit. You know what I mean? You get all
Mm-hmm.
those parameters discussed in one visit, as opposed to trying to listen to one person, one physician or healthcare provider, kind of, and then another healthcare provider said this, and how do you kind of merge those two
Yeah.
sometimes differing data? So you would be the final say, or I would be the final say, so to speak.
Are you able to practice with fewer time boundaries? Most of the doctors I listen to these days, I've been retired from medicine for a while, but most complain about the 7-minute visit and the amount of paperwork that you do get enough time to talk to your patients.
So right now in my practice in the health system, we do have a little bit longer appointment times than your regular primary care doctors. So, which is a good thing. And I don't think it's possible to do what we do in a 7-minute appointment. So we do
Mm-hmm.
have a longer time frame or a longer appointment slot for our patients.
Good.
Yeah.
Good. Even when they've seen you and they've got their basic treatment, and the follow-up appointments also can take as much time as needed.
Yeah, and because sometimes that's when the problem pops up. Because it's a chronic disease, right?
Yeah.
So relapses are very common, and and stuff. But yeah. So yeah, I think if I compare back home, I'm trying to think. I mean, what I hear from my family is it's still relying on gimmicks and pretty much the same thing that we're exposed to here for in terms of
That's
practice.
the magic pill
Mhm.
idea of,
Yeah, yeah,
for all aspects of medicine.
right, right.
Just fix it now, boom, with no
Mhm.
effort. Yeah, hard. What do you most miss about the Philippines? I assume
Food,
you can go home now and again, and there's quite a few places you can buy Filipino food, but probably not in Lebanon so much. But
right, right. Well, I'd say the food still, and the that's interesting coming from an obesity medicine doctor, right? The food, but it just kind
it's
of
a
reminds.
moderation. It doesn't have
Of
to
course,
be.
yes, of course. That is how what I preach to my patients and what I follow in my own life. I think because the food evokes a lot of emotions and attachments and memories. So I think it's that, and obviously my family's back home. All of my family is still back home. Immediate family, I should qualify.
Your uncle and aunt are still in Michigan.
Yep, and I have another aunt who lives in San Francisco.
Nice.
So, but yeah, my mom's back home. My siblings are back home.
Do you have children?
Do I have children?
Hmm.
Yeah, I have two crazy teenagers.
Oh, fun.
Yeah,
Have they been to the Philippines?
yeah, they have been. They've been there twice. I remember when we first brought them there, I think my kids were like 5 and 6. So it was a very long plane ride. That
It
that
is.
was a very successful plane ride because I remember, so it's a almost overall, I don't know, 28-hour flight, maybe.
Hmm.
I remember for our flight, I was prepared. I had like a toy every hour to distract them, but they did pretty good though at that age.
Where do you flew to California and then from California direct, or do you have to stop
So it was, I think it was New York and it stopped at Japan and Japan to the
Japan?
Philippines. Mhm.
Yeah, quite a lot. When I was in residency training, there were quite a lot of Americans who had gone to the Philippines to train.
Oh, really?
There was Mexico was the first major place that people were going to, Guadalajara, and then the Caribbean, and a lot of Americans go to the Philippines to train or used to. I don't know. It probably that's decreased in recent years. We've got more spaces in med
A
schools.
lot of Filipinos coming to America to
Oh
train? Is that
yeah,
what you
well, there were several Filipinos in my training program in New York, but no
Yeah.
Americans who had gone there and came back. There was we actually had a code once because we had a lot of Filipino nurses as well. We had
Yes.
somebody ran a code. I can't remember the name of your language other than it begins with a T, but they ran the whole code in your Filipino language
Tagalog.
because everybody except for me could speak.
That is funny. Yep, they were speaking in Tagalog. So Tagalog. So that's interesting. So the Philippines is a country, and the citizen is Filipino, and the language is Filipino as well. But in the Philippines, there's a lot of like dialects.
Mhm.
And I can't remember how many, but Tagalog is the more
That's the one. Yeah.
commonly used. Which, and again, percentage wise, I'm not sure how many used it, but some more common. Like I speak Tagalog.
Hmm. Yeah, a lot of our nurses, particularly in the NICU, were Filipino,
Mm-hmm. Yeah, yeah.
and it's a heavily Catholic community too. At least the immigrants that I knew were.
Yep. Well, actually, I also grew up Catholic. I think it's like 90% or something of the Philippines
Hmm.
Roman Catholic. And you'll see a lot of memes about Filipino nurses, and like if nurses go on strike, the hospital will not run or something to that effect, because there's a lot of
Our
like,
NICU wouldn't have would have
yeah,
been closed. I
yeah.
mean, there were nights when it was only Filipinos. I swear, in the group, a lot of nurses. Are there as many coming now? Do you think?
That one I don't know. Yeah, I'm not sure.
How about in Lebanon? Do you have a large Filipino community?
So I'm actually not in Lebanon anymore. That's where I
Oh,
trained.
okay. Sorry.
Yeah, yep, it's okay. So I live in a different area, still in Pennsylvania, but maybe like half an hour distance. Not a lot of Filipino. There are some. There definitely are some. Maybe not as like New York or anything like that. But there
Yeah,
are some.
there weren't very many Americans in our in
A
our community.
hodgepodge,
I
different.
mean,
Yeah.
some of us were immigrant before we were doctors, but
Where are you
most people.
originally from, Denise?
I'm from Salisbury, in England,
England. Okay, Salisbury.
and my husband is from the Dominican Republic. So hence the Mejia, which confuses you, because a lot
That's
of
right.
Filipinos also have Spanish last names.
Yes, yes, yes. So my maiden name is actually Fernando. So
Okay.
Spanish. I remember in residency when the patients would see my last name. And I kind of look a little Hispanic in a way,
Yeah.
not totally, but so they always assume I speak Spanish, like
Spanish, of course. Yeah.
poquito español. So yeah.
Yeah.
Right,
That
that's
was.
small, right? Poquito.
You're correct. Yes.
We haven't spoken in so long. So,
Yes. What's the predominant community where you are now?
this is, I think, more Caucasian white. This
Hmm.
white, where I am.
Is it a farming community or historically a farming community?
Not, no, no. I think we're surrounded by some, but suburban mostly.
Okay. Do you have anything else you would like to enlighten people with? Would you like to expound on the tourist advantages of going to the Philippines or anything else other than the 24-hour flight is required?
Yeah, so I'm trying to think. I mean, so I think the Philippines is well known for beaches.
Mm-hmm.
Couple of things. Beaches, there's a lot.
Mm-hmm.
The food, because there's a fusion of different cultures in the food, and I think the people,
Mm-hmm.
anybody that visits the Philippines always comes back with, I think, true impression of how friendly people are. Even if people don't know how to speak English, they'll try their very best to kind of, talk to you in their in how you would, I would call it, we call it broken English if they can't, but I'd say the Filipino people as a whole are very warm and open, and we laugh a lot,
Mm-hmm.
so I think if anybody visits the Philippines, they would probably want to trip back. And it's funny, I was at church today and I met a person. He said, "Oh, I just came back from the Philippines, and it was such an amazing time." So that's what I always hear when people come to the Philippines. So
Good.
hopefully somebody that's listening will get to visit it someday and
Yeah.
experience the beauty that our country has to offer.
As do so many countries. It's nice to
Of
hear,
course.
from everybody. One of the earlier interviews I did for this series was somebody from India.
Yeah.
It is what inspired me to do this series with immigrant doctors, honestly, is just the anatomy and physiology is the same the world over, but our attitudes towards health and life in general, there's some cultural differences, and I think they're interesting to explore.
Yeah.
Do you feel more American now, or do you still feel a sort of strong pull? 20 years is a long time.
Yeah, it is a long time. And I think my husband is also
It's
Caucasian,
American.
right?
Yeah.
So he's American. So I think there was a lot of kind of blending into the community as opposed to standing out.
Mm-hmm.
Uh, and actually, lately in this point in my life, in my career, I'm actually trying to trend back to just how do I say it? Really wanting to be more Filipino in a way, if that makes sense.
Mm-hmm. Mm-hmm.
Yeah, as opposed to just blending in. It's more like
Right. You
stand
feel
out.
you can be yourself now. You've
Yes. And
established
it's
yourself
not like
enough.
I wasn't
Yeah.
myself, but it was more like
Yes.
I was too
Right.
busy working and, just making life work, so to speak. And now,
Mm-hmm.
like, I'm in this point where it's this is part of me, my heritage,
Mm-hmm.
my culture, And
Do you think either of your boys or girls?
I have one of each.
Oh, how nice. Do you think either your son or your daughter will go to the Philippines to study at some point, or more
I don't
likely
know.
to
My
stay here?
daughter, I joke, because my daughter, she's into theater. She's a singer, actress at school. I mean,
Yeah, yeah.
So I always tell her, like, okay,
Aspiring.
aspire. You're right, right, right. I said, well, just you can go to the Philippines, and then you can be an actress there. I joke. So I don't know if she might. I'm for sure they'll visit, because they've talked to
Mhm.
me about coming there for a while now. I don't know about staying though. I'm not sure.
Is there much can you go and take like a semester abroad? Can you take a year abroad? Can you go to a Philippine university and then transfer back?
I'm pretty sure you can, because I remember in medical school we had a couple of classmates
Hmm.
that actually grew up in the States and did their medical school in the Philippines.
Yeah.
Yeah. So my kids
Yeah.
don't want to be doctors. They already told me that.
I'm a physician, obviously. My husband is an engineer. All three of my sons said, not going to do medicine, not going to do engineering. We've got one computer engineer and one physician. One kid managed to stay out of it. He's a city planner. But
So there's still hope, is what you're
this,
saying.
well, yeah, it's not there's hope. At some point they'll realize it, they don't have to fight it. It really is their decision what they do. And so they don't feel the need to tell you to back off.
Yeah.
I did
Yeah.
not. I told them if that, whatever they wanted to do had to be something they really wanted to do. Not
Right. Right. And I don't force my kids to. We just I just joke around, like, okay, this is gonna, you're gonna be right. They have their own path to walk. I know.
yeah. 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 Theater's hard. There's no set plan. So much of it relies on luck and being in the right place and the right opportunities will pop up.
And it's totally different from what I grew up. I grew up like science, study hard.
Mhm.
Theater is art that, right? It's that right side of the brain. And
It's
I'm
great.
not
It's creative. I mean, there's a lot of creativity in
yeah,
medicine too that tends to be ignored, but
yeah,
you've at least got set goals that you have to hit at certain
right,
periods.
right.
You can mark your path a little more easily that way.
Yeah, yeah, right. Yeah, there's like guideposts. So
Yeah,
to speak.
yeah, benchmarks. Yeah, makes it easier. It was really nice getting to know you a little bit. Thank you so much.
Yes, you
I
too. I
will.
love talking about my country, and obesity medicine is my
Yeah.
love and passion. So thanks for letting me visit and talk to you about all of that.
Yeah, and you're not very far from me. I'm in Delaware, so maybe I'll swing by sometime. Okay. Nice to meet you. Bye,
Right.
Case. Thank you.
Bye.
Thank you for joining us at Myth Magic Medicine. If you have found this episode useful, you can apply for free CME credit through the link provided in the transcript. If you're not a medical professional, please remember, while we're physicians, we're not your physicians. So please consult with your own healthcare professional if you think something you have heard might apply to you or a loved one. Until next time, bye-bye.